The toxicology reports on what killed everybody's friend, Matthew Perry, came out last week, and the results would really surprise you.
Friend star Matthew Perry died from the acute effects of ketamine, according to the just-released autopsy report. Ketamine is used to treat depression and anxiety. Sometimes it's used to treat addiction.
I know I found them quite shocking, because it said he died from the secondary effects of ketamine abuse, which as a board-certified retired anesthesiologist, I had found very interesting, because ketamine is a relatively safe medication. Ketamine is a dissociative anesthetic that became very popular during the Vietnam War. What was great about ketamine is it gave you analgesia. In other words, they could do surgery right in the field, and the patient would be relatively awake. They just wouldn't be processing the pain. And it didn't depress their breathing. There was no real respiratory depression with ketamine. So how does it kill Matthew Perry? Well, the reason why is he had the perfect storm of being a young person with a complex medical history, combined with mixing a couple of analgesics at the same time, and then taking them right at the wrong place at the wrong time. Let's see what I'm talking about. Matthew Perry was only 54 years old. However, he had an extensive medical history. Therefore, he was not nearly as healthy as your average 54-year-old. By the late 30s, Matthew Perry already had a narcotic addiction and could tolerate an astonishing 50 tablets of Vicodin per day. He also developed an alcohol addiction and had pancreatitis on several occasions. Pancreatitis is an inflammation of the pancreas, an organ intimately involved in digestion and insulin production. He did become a diabetic. He bounced back and forth between the narcotic and the alcohol addiction. He ruptured his bowel, probably secondary to constipation, secondary to the narcotics, and then trying to bear down on an impacted bowel. From what I've read, Matthew Perry was a very compassionate individual and always tried to extend a helping hand to other people who may be suffering with addiction. Unfortunately, if you're compassionate like that, your own shortcomings could lead to a depression. And he must have had a fairly profound drug-resistant depression because they were using ketamine. Ketamine, aside from being an anesthetic in the operating room, can be used to treat depression. It's usually given in a hospital setting intravenously. It could also be given intramuscularly as a shot. You could take a lozenge, and you could use an inhaler. The inhaler nasal spray is really the only FDA-approved method of treating depression with ketamine. However, the most common method is intravenous because you get the highest levels in the shortest amount of time. The last time Matthew Perry had received any IV ketamine was about a week and a half ago. So that ketamine would be long out of his system. Matthew Perry was also on buprenorphine. Buprenorphine is a narcotic that's used to wean someone off another narcotic, very similar to the way methadone works. Matthew Perry, unfortunately, was found in his jacuzzi, unconscious and unresuscitatable. The autopsy included a toxicology report, and his blood work came back with high doses of ketamine. In fact, doses that would be considered adequate for surgery, much higher than the doses you would see for someone getting treated for depression. And the medication he got during his depression would be long gone. So he had to take ketamine outside of that IV ketamine. He was also on buprenorphine, which is an opioid that's used to get somebody off another narcotic, very similar to the way methadone works. So how could this have killed him? Well, perfect storm. He's not healthy. He takes the ketamine, which has some sedative properties. He takes the buprenorphine, which gives him even more sedation. He then loses consciousness and slips under the water. When narcotized, you will not wake up if your nose and mouth go underwater in the tub. If you fall asleep while taking a bath, as soon as the water reaches that, you're going to quickly choke and wake up. When you're on a narcotic, or on any type of heavy analgesic, you're not going to wake up. So the combination of his illnesses, the ketamine, the buprenorphine, and having it happen in the jacuzzi was that lethal mixture. And unfortunately, if he had done this, if he had taken these medications in his living room, he probably would have just been unconscious and eventually woken up and been fine. But unfortunately, he did it in a jacuzzi. There's a few takeaways with this. He had quite a tolerance to be able to tolerate 50 tablets of Vicodin a day. It just goes to show you that even people with a high tolerance can chip over the edge and overdose. And unfortunately, even though he was my favorite friend on that show and he gave me a lot of laughter, it's just so unfortunate that somebody so kind and gentle would pass in this manner. And unfortunately, doing it in the jacuzzi added to the perfect combination that was lethal for him. I hope that this shed a little light on what could have killed everybody's favorite friend. And I think the best we could do is, if we know somebody who's suffering from addiction, to try to help them any way we can. Take care. Have a good day.